Today, we're looking at something pretty concerning, actually. As of early July 2025, the U.S. has hit a really grim milestone. We've seen more measles cases this year than any single year since it was declared eliminated. That was back in 2000.
Eliminated, yeah.
And it's the highest number in, well, over 3 decades.
That's quite a statistic.
Yeah, the count on July 7th was 12,281. Then by the 9th, 12,288. It blew past the 2019 record of 12,274 cases.
Wow.
So this isn't just, numbers on a page. It's a disease we really thought was basically gone, making a huge comeback. For this deep dive, we're leaning on data from the International Vaccine Access Center, IVC, at Johns Hopkins. They have this great interactive U.S. Measles Tracker.
That's a fantastic resource.
And also reporting from Stat News, which covers health and medicine really well. So our goal today is to unpack this. What does this resurgence mean? How do we even get here? And what are the experts saying? I mean, how does an eliminated disease just reappear like this?
Well, that's the crux of it, isn't it? Understanding what elimination status actually involves is really important, and why losing it is a big deal.
Right.
See, eliminated doesn't mean 0 cases, like ever. It means there's no continuous ongoing spread and no endemic spread within the country.
Okay.
You can still get imported cases. Someone travels, gets infected abroad, brings it back. That happens.
Right. That makes sense.
The danger is when those imported cases spark chains of transmission that we don't manage to shut down quickly. And that's the situation the U.S. is facing now, losing that status. It's a serious setback for public health.
And it's not just about the case count, is it? There's a real human cost.
Absolutely.
We've had 3 deaths from measles in the U.S. this year, 2 children and an adult.
Which is tragic and rare recently.
Exactly. First measles deaths in a decade. And the first time we've seen this many deaths in 1 year since, well, before 2000.
It underscores the seriousness.
And on top of that, about 12% of all the confirmed cases needed hospital care.
So it's not a trivial illness by any means.
Not at all. And it's widespread cases reported in 37 states.
Wow, 37.
Yeah. And just for context, this 2025 number, 1,288 and counting, it's the highest since 1992. Back then it was over 2,100 cases.
So we're heading back towards levels we haven't seen in a very long time.
Feels that way. You mentioned the data sources earlier, like the U.S. Measles Tracker. What can that kind of detailed county-level data tell us?
Oh, it's incredibly valuable. The tracker, developed by IVC and the Center for Systems Science and Engineering at Hopkins, gives this really high-resolution picture, county by county.
Which is more detail than you usually get.
Exactly. It complements the state-level stuff. It tracks cases by age, by vaccination status, and the data's public on GitHub.
Okay.
So researchers, public health officials, even the public can see what's happening, where it's happening. And as Lauren Gardner from Johns Hopkins points out, diseases just don't care about borders, right? County lines, state lines.
Yeah, true.
So having that granular view helps understand the spread and hopefully helps contain it faster. It's vital for informed decisions.
It's wild because, as we said, we did eliminate it before, 2000.
We did.
And that largely came after a key policy change in 1989. Right. Introducing the 2-dose vaccine schedule.
That's right. There was a spike in cases, even among some vaccinated kids, which led to adopting the 2-dose MMR vaccine approach.
And it worked incredibly well. Cases dropped fast. That 2-dose regimen is something like 97% effective.
Hugely effective. It was a major public health win.
So maintaining that elimination status, you said it requires vigilance.
Constant vigilance and really high community immunity, that herd immunity concept.
Right.
Again, elimination means no endemic spread. Imports happen, transmission can follow, but if you can't stop those chains of spread within 12 months...
Then it's considered endemic again.
Exactly.
Yeah.
Then the virus is circulating continuously and the country loses that elimination status. That's the threshold we're bumping up against.
And the sources are pretty clear on the main reason why we're seeing this resurgence now.
Yes, unfortunately, it's quite clear.
Nearly all the cases this year, 2025, are in people who are unvaccinated, or maybe their status just isn't known. And it's across a wide range of ages, which suggests these aren't new gaps necessarily, but sort of long-standing vulnerabilities in vaccine coverage.
Right. It points to persistent pockets where immunity levels are too low.
And William Moss from IVAC, he highlighted the issue of vaccine confidence being undermined. What's the effect of that on actual vaccination rates?
We're definitely seeing a concerning dip. For the last school year, 2023-24, The national kindergarten vaccination rate was 92.7%.
Which sounds high, but
it's below the threshold needed for measles. You need about 95% coverage to really stop this virus because it's so incredibly contagious.
95%.
Yeah, and look at Gaines County, Texas, the heart of the biggest outbreak. Their measles vaccination rate is down in the low 80s.
Ah, okay. So that creates a perfect storm, basically.
Precisely. That's where the virus finds fertile ground.
Let's talk about those outbreaks. The sources say there have been multiple introductions of the virus just this year.
Several separate importations, yes.
Leading to at least 27 distinct outbreaks. And an outbreak is defined as what, 3 or more linked cases?
Correct. 3 or more cases connected to each other.
And those 27 outbreaks account for almost 90%, 88% of all the confirmed cases.
So it's not just scattered individual cases, it's clusters of transmission.
And the biggest one by far, West Texas.
Yes. That outbreak accounts for the majority of cases nationwide.
It's centered in Mennonite communities there. And the thinking is it was sparked by spread from a big outbreak happening up in Canada.
That seems to be the connection, yes.
And worryingly, it looked like that Texas outbreak didn't stay contained. It spread to Oklahoma, Kansas, New Mexico, maybe even Mexico.
Yeah, the reporting suggests links to Mexico, which has seen a huge surge itself. Thousands of suspected cases, over 2,000 confirmed, and sadly 9 deaths reported there this year. Canada has reported 1 death too.
It just drives home that point about borders meaning nothing to a virus.
Exactly what Lauren Gardner said. And, this isn't entirely unprecedented. We saw something similar back in 2019.
Right, you mentioned that earlier, New York City area.
Yes, large, long-running outbreaks, primarily in Orthodox Jewish communities where vaccination rates had fallen. The U.S. came very close to losing its elimination status then.
So it's a recurring threat when vaccination levels drop in specific communities.
It seems to be. Catherine Wells, the public health director in Lubbock, Texas, noted that while their big outbreak seems to have quieted down recently, the overall concern about losing elimination status is still very much alive.
She also said something quite stark, didn't she, about a new normal.
She did, quoting her, "I think unless we do something to really increase vaccination rates across the country, this is going to be kind of a new normal of seeing these outbreaks in different parts of the U.S.
Wow, a new normal of measles outbreaks.
And she added, "Measles really is an airplane right away. It's a car right away," highlighting how connected we are.
It's a chilling thought. And are we even sure the official numbers capture the full scale?
Well, that's a major concern. Paul Offit, a well-known pediatrician, he stated pretty bluntly that the confirmed cases are virtually certainly an underestimate.
An underestimate. Why?
He pointed to the West Texas outbreak, specifically in the Mennonite community, where many families apparently didn't seek medical care unless someone got seriously ill.
Ah, okay. So mild or moderate cases might just not be reported.
Exactly. His point was the first sign officials had was when 2 kids were hospitalized in Lubbock. That suggests it was already spreading significantly before it hit the official radar. The tip of the iceberg, as he put it.
So the real number could be considerably higher.
It's very likely, which makes the situation even more worrying than the official stats suggest.
Offit also shared this really striking anecdote, didn't he, about the lost memory of measles.
Yes, it's quite powerful. He recalled talking to Maurice Hilleman back in 2004. Hilleman led the development of the measles vaccine.
A legend in vaccinology.
Truly. And Offit asked him if education could combat the growing vaccine misinformation. Hilleman's response was basically no. He predicted that people would only really grasp the vaccine's value and the danger of measles if they saw the disease come back.
Yeah, it's incredibly prescient and sad.
It is. And Offit elaborated on that idea. He said, "I think the problem with measles is not only that we largely eliminated it, but that we eliminated the memory of measles."
It eliminated the memory.
Yeah. He followed up, "I don't think people remember how sick that virus can make you."
So the very success of the vaccine led to a kind of collective amnesia about the disease itself.
That seems to be his point. It raises this fundamental question. What happens when generations grow up without the lived experience of a serious disease? Does the perceived need for prevention fade?
That really makes you think, if we've lost the memory, how do public health officials even respond effectively? You can't rely on fear of a forgotten threat.
It's a huge communication challenge. Maybe the focus needs to shift from just the immediate threat to the positive value of prevention, highlighting the collective benefit, the science, the history, trying to build understanding rather than relying on fear or recent memory.
It's tricky. Now, what about the official government response? The Department of Health and Human Services, HHS.
Well, HHS has said they've taken steps in response to the outbreaks.
Okay.
But a statement they forwarded, according to STAT, stressed that measles vaccination is a personal choice. It also emphasized that the overall risk of catching measles in the U.S. is still low, lower than in some comparable countries.
A personal choice. That phrasing stands out during an outbreak.
It does, and public health experts have voiced some frustration, reportedly. They feel that the health secretary, Robert F. Kennedy Jr., hasn't made that strong, clear appeal for vaccination that's considered, the standard public health playbook during an outbreak like this.
So sort of different messaging approaches there?
Definitely. One focuses on individual autonomy and current low risk. The other emphasizes the need for urgent collective action to stop the spread and protect the vulnerable. How those different messages land with the public, well, that can really impact the response.
Okay, so let's just quickly pull the main threads together for you listening.
Good idea.
First, we're seeing a record number of measles cases in 2025, highest since elimination in 2000, highest in over 30 years.
A major resurgence.
Second, this puts the U.S. at real risk of losing its official measles elimination status.
A status hard-won through vaccination.
Third, the clear driver is declining vaccination rates, leaving gaps in community protection.
Linked to both access and confidence issues.
And finally, experts are warning this could become a new normal if vaccination rates don't improve. Outbreaks becoming more common.
Yeah, the potential for measles to become a regular feature again.
And understanding the data, like from the Measles Tracker, is just so critical here.
Absolutely. Accurate, timely information is the bedrock of good public health. It lets officials track the spread, target interventions, and it helps all of us make informed choices. Seeing the patterns, the vulnerabilities, it's essential.
So wrapping this up, what does it all mean for you? If that memory of measles really has faded, like Paul often suggests, how do we make sure the lessons we learned, the achievements like eliminating this disease, aren't just lost on future generations? Something to think about. Thanks for diving deep with us.